Welcome back for our next panel discussion on sustainable procurement with our partners at Vileda Professional. To achieve net zero, the NHS must look at scope 3 emissions, those which aren't directly produced by the NHS, but by procuring services and products. Scope 3 includes emissions produced by organisations within the NHS supply chain. These include water and waste, business and staff travel in the delivery of care, pharmaceuticals and chemicals, to name just a few. From this month, the NHS requires suppliers to publish a carbon reduction plan for their UK Scope 1 and 2 emissions and a subset of Scope 3 emissions as a minimum for all contracts above £5 million. This is in preparation for April 2030, when suppliers will only qualify for an NHS contract if they're able to demonstrate their sustainability capabilities through progress reports and emissions reporting via the Evergreen Sustainable Supplier Assessment. So in this discussion, we'll be examining how NHS procurement officials and the supply chain working together can meet their net zero targets by 2048 through the introduction of better guidelines. So I'd like to welcome our panelists. We have with us John Wilson, UK Sales Manager for Vileda Professional, Alexandra Hammond, Head of Sustainable Procurement and Supply Chain at NHS England, and Heidi Barnum, Head of Sustainability, NHS Supply Chain. Don't forget to join in with the conversation by using our Q&A function on the right-hand side of your screen. I enjoyed you doing that in panel discussion 1. So welcome to all our guests. And John, I just thought I'd kick off. You're an expert in healthcare cleaning. You've got a couple of decades experience in that field. But for many of us, if I'm honest, as a patient and visitor and somebody who uses the NHS when required, I never think of cleaning unless it's bad. And so I don't know whether yours is a bit of a thankless task, but you're such a critical part of the NHS. Can you give us an idea of where it fits in and at what kind of scale?
Yeah, sure. I mean, obviously, millions of pounds are spent every year on cleaning products with many different suppliers, and again, it's like you say, it's something that's not always noticed until you're lying in a hospital bed, maybe for a couple of weeks' time, and looking at the four walls, and it's then when you start to notice the cleaning that is actually done, and you pay a lot more attention to methods and what's used, and you might ask a few questions. So it's something that's, again, sort of goes under the radar a little bit, but cleaning methods within hospitals in particular have moved on essentially from the mid 90s, when the likes of microfiber was introduced into the NHS, and inadvertently made things a little bit greener, without hospitals probably knowing that was the effect that was having, because products had a lot more longevity, cleaning methods were made simpler, and less chemicals and less water were used. But still, to this day, there are many hospitals using methods of cleaning that have been used for years and years and years. And I think it's through talking to suppliers and through new contracts, etc., where new methods of cleaning, can be explored, and sustainable methods can be explored fully.
Well, we'll talk in a minute about what impact the cleaning world can make as far as sustainability goes. But let's bring Alex into the conversation. Alex, just explain for us, what is decarbonisation of the supply chain?
Hi, Helen, and thanks for having me today. So I'll just set the context a little bit. So the NHS in England accounts for about 5% of all emissions in the country. Our total impact is similar to a country the size of Denmark. So we have a big impact. Our supply chain emissions are over 60% of that impact. So all of the hospitals we run and all of the services that we provide, et cetera, that's a big part of our carbon impact. But actually, the real bulk of our impact sits within the products and services that we buy into our hospitals and to deliver the care that we so need to do. And so we simply can't get to a net zero National Health Service or a net zero anything without looking to our suppliers. And so when we're talking about decarbonizing our supply chain, we're talking about not our own houses in order and saying that, okay, we need to have sustainable sources of heat in our hospitals, and we need to have really cleaning services that are, reducing waste and emissions, but actually saying to our suppliers that they need to be doing that too, and that their suppliers need to be doing it, and looking down the value chain of the products and services that we buy. So, decarbonizing our supply chain is no mean feat. It's going to take quite a lot of collaboration and partnership, and that's really why we've put together our net zero supply roadmap, which I'm sure we'll talk about.
Yeah, is Heidi, is that something you can talk about, the roadmap there, and just basically how important the contribution of the decarbonisation of the supply chain, how important that contribution is to the NHS's overall net zero ambition?
Absolutely. And for me, kind of moving on from what Alex has said, it's also about understanding the changes as the NHS that we're going to have to make, because it's not just about our suppliers, it's also about our own behaviours and what we buy. And we might need to change the products that we use. We might need to change the way in which we use those products and change the way that we deliver certain services. And it's only by kind of combining the efforts of suppliers and ourselves that we're going to get anywhere near the level of the ambition that we've got. And in terms of the roadmap, for me, I think it's a really good tool to try and explain to the huge variety of suppliers we have within the NHS, the route that we're going down and why we're going down that route. And I think one of the things I like to try and explain to people is that within NHS supply chain, within our organisation, we've got over 600,000 products on our catalogue, varying from everything from paper that you write on, to toilet paper, to toothbrushes, to very complicated medical devices. And when you're dealing with that breadth of product, having simple messaging and key milestones so that you can kind of help people pin that journey and understand what it means to them is really important.
Just thinking, Heidi, about those more than 600,000 products, have you just got an example maybe of something from those that you could pluck that's been changed, or that an organizations can change, that then makes a big difference? Obviously cleaning is key, but we'll talk to John about that. But anything that really springs to mind, because these numbers are huge, which means small changes presumably can actually make a massive difference.
They can, and there are some simple swaps. Things like moving from virgin fibre paper to recycled paper is quite an easy swap. But then you get into other swaps, like changing from single-use items into reusable items. But that is much more complicated because it requires a system around it for it to be reusable, particularly where items need cleaning or decontamination, is where some of the cleaning items come in. So things like reusable PPE that are being developed, they are great. It will take us away from a single use requirement, but it also, then you have to start thinking about sterilisation, decontamination, and the infrastructure around managing cleaning services as well.
Cleaning services leads us nicely back to John. John, when did you first see a shift with trusts, starting to invest in sustainable solutions and products, and perhaps taking more interest than they might have done in the past?
Inadvertently, it was kind of the mid-90s, where traditional methods for cleaning, like single buckets and throwaway wipes, that were used, and some are still used to this day. But then pre-prepared methods were used that used less water, less chemicals, and the products that were used had more longevity. But I think this was more, a sort of a subconscious effort to change, rather than a definite aim to be greener. And I think within the last couple of years, you'll see that suppliers have more and more offerings as far as being greener and more sustainable is concerned, and helping to reduce the carbon footprint. And there are things now available from suppliers like CO2 calculators. So if you switch a product, you can prove what that will save in CO2 emissions, etc., and things like that. So there are there are things there available. We just we just need to talk to each other and see what's available out there, and look at what the current methods are in hospitals to be able to make those changes.
Absolutely. Alex, how then are healthcare workers working directly with their supply chains? What's going on? What's going on in terms of communication?
Well, one of the things, just picking up on what John said, is it's so important that we make it forward for our people in working in big hospitals and health services to make these behavioral changes and shifts. And I think one of the things that has been focused on is creating kind of really simple, straightforward for our to make those changes. So for a single-use plastics or reusable plastics guide to avoid single-use plastics in catering. We've got a device remanufacturing how-to guide. So taking the things that are really happening and doing and going well in certain parts of the NHS and giving people the information to scale up that behavior is a really important thing. And I think what we are finding more and more is that, we don't, my essentially a, kind of a here to sort of break down barriers and find solutions to problems. But so much of this stuff is happening from our supply chain. There's great from our suppliers that they're going to our NHS organizations, they're getting things started, and NHS organizations are really, really enthusiastic about this. And the really key thing that we need to achieve is finding a way to make that consistent and scalable, and not just in England and the NHS, really than our own four walls of here. Looking at the devolved nations and also to international healthcare services. I think I'm not sure if my screen is freezing, but it looks a little slow to me, but hopefully it's okay.
It's a tiny bit slow, but we can hear you properly. And if I look distracted, I keep flicking to the right-hand side of my screen to see what questions we've got. So just while I've got you there, Alex, because we'll take a few audience questions as we go along. Tom's asking, given financial pressures on the NHS as a whole, how will the balance between cost and carbon reduction be managed, and at what level?
So this is a really important question, and something that I think as a team we can't ignore. I think I just would sort of challenge that sustainable is, there's a lot of examples. One that before around switching from virgin pulp paper to recycled paper. It's cheaper to do recycled paper. It's just less expensive. It does, what John's talking about, moving to microfibers and the sort of inadvertent changes that people are making because they're just better ways of doing things, is a to keep in mind. So we really need to focus on the areas where there's that dual benefit. Sustainability at its very nature, its very core, is about doing things with fewer resources and doing them better. And so I think we mustn't ignore the fact that there might be additional. But I think we also need to understand that sort of move away from the conversation that sustainable always has to be more expensive. It doesn't. And where it is more expensive, we need to look at the longer it delivers. If the initial cost of something is higher, but actually it means that we don't need to incinerate it at huge volumes, then that all needs to be factored in. So that's another area where we're looking at trying to move away from just focusing on the single cost of an item or the single cost of a service up front, and looking at the long-term value of that item or service going forward.
Just briefly, I'm coming to you in a second, Heidi, but just briefly, John, I saw you nodding away there, and I was going to ask you actually whether when people make the switch with Vyleda and they take your more sustainable products, does that necessarily mean an increase in price, or are they more reasonably priced? How do you balance that?
And Alex is definitely right there. I mean, yeah, there's an initial cost to implementation, but because the products are so durable and they use less water, less chemical, etc., over time, it's a spend to save. Not only is it a more hygienic way of cleaning, but it's actually a cost saving. So, and a reduction in water, taking it down to basics. If you can imagine somebody using a single bucket with some water in, they mop a floor and they wring out into a bucket. Well, then that water is then contaminated, so it has to be changed for every room that you go into. So you can imagine day in day out the amount of water that is used, the amount of chemical for every bucket that is used. It doesn't have to be that way at all. There are methods now available where there's just far less water and far less chemical. Products last for longer, and you know what? It's a lot more hygienic as well. So it's a win-win situation for everybody, and it's easier for the actual operative who's using the product.
I'm just curious, John, just give me an example, because I've got that image now of the mop and the bucket and the squidging it out. What cleans the floor instead, say, of the old fashioned kind of way of the squidgy mop or whatever?
Yeah, sure. Now, I spoke about pre-prepared mopping, for example. So you would have a number of mops in a box. Basically, you would place a sieve on top. You would pour all your water, which is far less than you would for a normal bucket, and then you would use a separate mop for every single room that you go in. So you're not spreading any potential infection around. You're using a fresh, clean mop for every area. And the amount of water you put into those mops is far, far less. Yeah, and again, as I said before, far less chemical. And the floors dry quicker. There's less chance of slips and trips, etc. It's just far more sustainable, far more hygienic. At the moment, again, that single mop you're talking about is generally a mop with a plastic socket on, which is generally virgin plastic. And again, if you're using a disposable one of those, and I think it's last count about 5 to 6 million of those are used every year within the NHS. And there's a simple solution, and it doesn't, like Alex said, it doesn't cost a fortune.
Yeah.
It's actually a saving.
Heidi, I would imagine all of this work is probably really improving engagement and dialogue between NHS England and its suppliers. So it's kind of a win-win, isn't it?
Absolutely, and one of the calls I have later today is our monthly supplier forum, and I'm asked to go back every month because it's a conversation they want to keep having, and they want to be engaged. They want to know how that they can support us and talk to us about the innovations that they're making and the work that they're doing. It's not just a buzzword. It's something that is organisations are a long way down the road of having looked at their own operations for many of the reasons we've just talked about. The fact that actually business, and when you take much less the transactional but much more the whole life cost approach, actually carbon savings result in cost savings, which means that they can offer a better product at a better price.
Heidi, Dan asks, can you tell us about the questions suppliers are asked around sustainability and social value prior to acceptance onto frameworks? Are any claims investigated and contract managed as part of their NHS supply chain approved status?
So I think there's 2 points I'll talk about around here, and Alex, feel free to chip in. So we have the carbon reduction plans, which you talked about at the top of the call, which the go live date was the first this month. So from that point, any contract over 5 million, we are doing there is a requirement for a carbon reduction plan for contracts over 5 million. So that's a pass fail requirement. They have to have a carbon reduction plan that meets the requirements of the PPN. So that is in place. So that's kind of the claims piece. When it then comes into social value and what's asked through the tendering process, we ask questions around social value, and it's 10% of the as a minimum of the weighting of the tender. One of the questions specifically for us is around fighting climate change, and what we ask for is what is the potential that they can offer during that contract. We've been doing that for the last year, and we are still learning about what are good questions. And again, if you think about the 144 different frameworks and categories of product we've got, what good looks like in each of those will be slightly different, because the material impacts of those products and services is different across that range. And I think from a customer point of view, we're only just really beginning to understand how that then translates into what does that mean on the ground? What's that actually mean for the person at the end of the day using this product? What are they going to see or feel that's different?
Cool. Alex, did you want to, that was a very eloquent answer, but anything you wanted to add there, Alex?
I would just say that, we acknowledge that this is a thing and quite subjective to our procurements. We made this a requirement as part of our net zero roadmap from April 2022, so this time last year. And so our procurement teams and our suppliers are still learning about how to make this as effective as it possibly can be. But we really are doing a huge amount to try to make sure that our commercial teams have the right skills and understanding to get good, really meaningful questions in, and that we're also making sure that we're seeing through those commitments through the contract and the life of the contract. And that is something that we've got a lot of feedback from suppliers. We hear them. We know we're not perfect, but we are really working hard to try to make this meaningful, because it's so important. We spend billions and billions within the NHS every single year, and we have a huge, huge opportunity to make that really help and impact our communities, our environment. And so that's really the aim behind this inclusion. And so we're really dedicated to making it work.
I like the way you use the word opportunity, because that really is how it should be seen, I think, and an exciting opportunity too. George has a question. John, a question actually that came across my mind. It's just jumped off my screen. Hang on a second. Where's that question gone? And it is something that popped into my head when you were talking about mops a moment ago. Oh, there's George's question. Whilst using individual mop heads for rooms saves water and chemicals, does this not increase the amount of single-use mop heads? Or perhaps they're recyclable, are they?
No, the mop heads I was talking about are durable mop heads that can be laundered, and up to 1,000 times. So probably you're getting nearly 3 years worth of usage out of those mops, and all the mops, especially that by Leader do now, are made from recycled materials and can be recycled. So yeah, it's we're not talking about single use. We're talking about durable mops that will last a long time.
Fantastic. And John, are there any steps you could recommend that NHS trusts can take quickly and immediately to make a difference in starting to reduce their cleaning carbon footprint?
Definitely. Just again, I say talk to suppliers. Let suppliers look at their current cleaning methods. As I spoke about before, the plastic throwaway socket mops that I think nearly £2 million a year is spent on those sorts of products that doesn't need to be. Even single-use products now, like mops and cloths, are made now by quite a few manufacturers from recycled materials. So even the single-use option can be greener, can be more sustainable. So it doesn't have to be. There can be immediate changes to make everything more sustainable. We just need to talk to each other.
Yeah, and it's sharing ideas, isn't it? I'm involved in Orbis, which is a charity with the Flying Eye Hospital, and they help restore people's sight by the operating theatres on a Boeing, and they fly into places like Africa and not only perform surgery on board the aircraft, but also teach the local medics better ways of perhaps cataract operations, etc. And talking to an anaesthetist who's involved in Moorfields sustainability plans, who works on the Flying Eye Hospital or volunteers, he was saying they're learning things about single plastics from Africa, because in places like Africa, they don't have access to single-use plastic. So he's coming back from places like Ethiopia with sustainable ideas that are being used in very poor countries with very few resources. And he said it gives him great satisfaction that it's a two-way learning curve. And I think that's important, Alex, isn't it? That, you know, certainly where you sit at NHS England, you're in that perfect position to share good practices. And when you see things that are working, to spread the word and make a real difference.
Yeah, I think, you know, one of the things that we are really conscious of in the NHS is that, yes, we are the first health service, there's Heidi's cat, to commit to net zero and you know, we are really leading the charge. We're getting such a huge amount of interest from other countries. We're now amongst, I've lost count how many countries now have committed to net zero. But we're still learning, and we probably need to even be more ambitious. And we learn so much from our supply chain, who are doing great things, and sometimes just need an opportunity to be able to get their their products or their innovative services out in front of the people that need to buy them. And I think we do appreciate that. Our 2028 milestone, for example, we're going to be asking our suppliers to tell us the carbon impact of the products and services that they provide to us. And that's a big ask. And what we're learning is that there are a lot of industries that are already looking into this, and they have really mature thinking on this. And so we're working with them, and we're not going to make it up ourselves. We really need to understand from using it at independent experts and industry to say, what is the right way to do this? What is the realistic way to do this? How is it meaningful to people who are making the decisions of what to buy? So absolutely, it's a collaborative approach. It really always needs to be.
Slightly distracted by the puma or the cat, which is either hickory or dickory, which has landed on Heidi's. Is that hickory or dickory, Heidi?
This is dickory.
Oh my goodness, what a large cat. Just following on from what Alex was saying there, Heidi, I mean, presumably the focus on sustainability is just going to increase as every year goes by. And I'm wondering, will businesses who don't take their sustainability credentials seriously end up being left out in the cold longer term with all the targets now that the NHS have set for their suppliers?
Absolutely, and that's one of the things, the milestones that's in the supplier roadmap, and also more broadly that is in UK legislation. We cannot not do work on this. From what was set out in the Delivering Net Zero ambitions and report back in 2020 is that the climate crisis is a health crisis, and if we don't act, we're the ones who are going to have to pick up the pieces anyway. So we need to act. It is meaningful not only because of what we morally have an obligation for, but actually what we do every day in terms of delivering healthcare. It's healthcare and health outcomes that are being impacted by this. So we have to act.
We do. Alex, just looking at a question from Sally. Sally says, as a supplier to the NHS of single-use disposable items, we've identified that one of the biggest challenges within acute trusts is the appropriate facilities and processes to recycle products accordingly. Whilst we're committed to driving recycling and have documented it as part of our CRP, it is incredibly difficult to gain engagement for change within individual trusts. Any advice on how to gain more engagement?
Well, first of all, brilliant. You've got a carbon reduction plan, or a CRP, which all of our contracts over 5 million need from the 1st of April for procurements that start after that date. So great to hear that you've done that. Yes, I totally agree. This is a lot of this has to do with some of the logistics. I think the key thing is finding the right contact. We have a team within NHS England that is looks at estates and facilities. We've got a waste innovations manager. So his name is Liam Hogg. Sorry, Liam. But do look him up, and because I think we need to be coordinating these things. We need to be enabling recycling and the sustainable use of resources.
George says, do cleaning companies like Valida provide ongoing data comparing reusable wipes and disposable wipes with regards to the effectiveness for infection control?
Yes, definitely. And the one thing that sustainable products have to have is still have that quality of the clean. And so at Bylida, we have total independent testing of all our both durable and single-use microfiber products to remove not only 99.99% bacteria, but also viruses as well. And so you have to have that backup, particularly for infection control purposes. But within those products, obviously now we are including stuff like something like a CO2 calculator for those products, showing that if you do switch to those products, this is how greener you will be, and this is how more sustainable you will be. So it's all there. It's all available.
And just a final thought, John, because our time is always against us. The half hours always whiz by. But I'm just wondering, in terms of your world and sustainability, what's needed most? Where do we need to invest in to develop further?
Well, I think it has to come down from the top. But as I say, like Alex said previously, it doesn't have to cost a fortune. In fact, in most cases, the hospitals could make a saving over time. So as I said before, it's a win-win situation that you're going to be more hygienic, you're going to be a lot greener, more sustainability, and more user friendly for the operatives that on the ward floors that are using them. So it's a win-win for everybody.
Fantastic. Well, another great conversation. I'd like to say a massive thank you to you, our panelists, to John, Alex, and Heidi. Special guest appearance by, I think it was Dickory, actually. And you've given us some great insight there. And a massive thank you as well to our audience for taking part and submitting questions. And thank you to Bylida Professional for partnering with this panel. It is time now for another break. So please do take this opportunity to network with your fellow participants by using our speed networking function, and I'll see you at 11:35 for our final session before lunch.